Pretty much every animal that walks in my door is fat and has arthritis. In a study that just looked at radiographs of cats over 12 years of age, 90% of them had osteoarthritis. Knowing this dog's going to have a problem, you want to start educating the owner right now. I look at that dog and I immediately think, gosh, this dog's going to have a polyarthropathy or something. It's that, that I don't want to walk on a hot tin roof kind of look. When do we start talking about OA care for this owner? Now.
Welcome to Dr Goldsmid.
Okay, so I'm very happy to come and talk to you today about using Metabolic Plus and osteoarthritis management in dogs because I'm kind of passionate about it. Pretty much every animal that walks in my door is fat and has arthritis. So that kind of means that I have a large base of clients that I need to be recommending this diet to. So I'm very happy to recommend it. I use it all the time. I previously used JD and Metabolic separately. And I think, they're fantastic diets. And then putting it together, perfect. That works really well for most of my patients because I had the same dilemma that Maureen talked about of you have the fat, overweight dog that has the arthritis. What do? You have to make it lose weight and then you have to use a separate nutraceutical. It's much easier to have it all combined. So hopefully today you can learn a little bit more about osteoarthritis and the association between that and overweightness or obesity. And I think hopefully we can start treating osteoarthritis maybe a little bit better in our practice. Okay, so just a little bit about me. We've already said I have the Animal Referral Hospital. You're welcome if you ever come to Sydney or Canberra to visit one of our animal referral hospitals. We are very happy to have people come and watch surgery or watch procedures. If you send something in, you're welcome to come and see the surgery on that case. So come and visit us. Okay, now some interesting statistics just to kind of look at how significant osteoarthritis is in patients and in us. Let's have a look and see what the statistics show us. So in people, there is overall in the population at least 2%, including from young age, would have clinical osteoarthritis, under the age of 45 that is. Once you start getting older, for us oldies, bad luck, increase to a third or so of people will have osteoarthritis once they get over the age of 45. Gets worse as you get older. So up to 85% or so of people will have osteoarthritis once they reach over 65. So I think it's something that could be significant for all of us, so we need to have a think about that. About 90% of the American population has some features of osteoarthritis. So they may not be clinically uncomfortable with it, but they have some features of osteoarthritis in their weight-bearing joints, even by the age of 40. So a lot of people will have osteoarthritis brewing. They may not know it yet, but there's signs there that look like they're going to develop it, become clinical later. Bad luck if you're male, you're more likely to develop osteoarthritis earlier than women. And in Australia, 1.8 million Australians suffer from osteoarthritis. That's a large number of people. So I'm sure some of you in this room have this problem and it affects your life and your function, your work. In fact, in the last decade, something like, there's been an increase of something like 88% in joint replacements for osteoarthritis. So knee replacements, hip replacements, that sort of thing. Okay, what about in dogs? So 20% of adult dogs in North America have osteoarthritis. So think about how many dogs in North America. That's a large number of dogs. Once they get over 8 years of age, 80% will have osteoarthritis. Think about all your patients that come into your clinic that are over 8. 80% of them will have osteoarthritis. Okay, what about cats? We don't see osteoarthritis in cats. Well, we don't recognise osteoarthritis in cats. I think that's probably the more appropriate statement. So in a study that just looked at radiographs of cats over 12 years of age, 90% of them had osteoarthritis. Only 4% of those cats had actually had a diagnosis of osteoarthritis. We're really underdiagnosing cats because cats mask everything. They don't show you that I have a problem. So my cat, I have 2 cats. You'll see one of them later, who's the poster boy for Metabolic. My other cat is 15, 16 or so, Burmese. He has osteoarthritis. I know that not because he's really lame or anything. He just has difficulty jumping up on stuff now. I have to lift him up on I have to put him on the washing machine so the dog doesn't eat his food. He can get down, but he can't get up because he has osteoarthritis in his pelvis. So I know because he's changed his behaviour, not because he's lame. So it's a little different in cats in making the diagnosis. Overall, there's probably a 22 to 34% osteoarthritis rate, at least radiographically, in cats, but we just don't diagnose them. So have a think about the cats that you see in your practice. Okay, so more interesting statistics. If there's 4.2 million pet dogs in Australia, so 39% of households have a dog. That's 19 dogs for every 100 people. And there's 3.3 million cats in Australia. This is a little bit old information now, but it's probably still holds, so at least 29% of households with a cat. Okay, so 2014, that information came out. What were their 4 top health concerns? So when people were asked what were their 4 top health concerns for their pets, what do you think they said? Obesity, weight, absolutely. Arthritis, top 2. Skin and dental. So that's what people were worried about. That's what would concern them most about their pets. So the first 2 things, weight and arthritis, perfect. That's exactly what we're talking about today. All right. So we have 840,000 roughly dogs with osteoarthritis in Australia and 800,000 cats that we should all be treating maybe a little bit better if the owners let us. Okay. All right. So let's think about obesity and osteoarthritis and the link. There has been a study that's just been published recently, and you may or may not have seen there was a bit of a media release on it earlier this year. So earlier in the year, Arthritis Care and Research published a landmark study that had been done in conjunction with insurance companies, and you can imagine the insurance companies really benefit from reducing the number of hip replacements and knee replacements that are done, because that costs a huge amount for the insurance company. So they were really keen to do this study. They basically wanted to look at the relationship between weight loss and improvement in symptoms associated with osteoarthritis. And the premise is that for every kilo that is increased in weight, you're putting 4 kilo weight on, say, the knee joint. So knee joint particularly seems to be related. Arthritis in the knee joint particularly seems to be related to weight. So that's what they were looking at. So they had an 18-week program that they put these people on. It's about 1,400 people in the study. It involved a diet plan. They had exercise programs. They had a kind of mental coach to help them through this process. And on average, they lost about 10% of weight. And for each of that 10%, they had a 40% improvement in their clinical signs. So a lot of the people who were really suffering from their clinical signs after the weight loss found that they were much more mobile, they could do more exercise, they didn't then need the replacement necessarily that they were lined up for. So it actually made a huge difference to these people's lives, and not necessarily a huge amount of weight loss. Average, I think, was 8 kilos or so. So huge kind of link there that they found and could make a significant difference. Okay, so what's the story in dogs? Do we know if this is the same in dogs? So a paper came out in the Veterinary Comparative Orthopaedic and Traumatology journal in 2009 out of Glasgow, I think. Marshall is based in Glasgow. And they looked at the literature and what did we know about this. They wanted to answer 2 questions. So firstly, does prevention of canine overweightness, which I didn't even know was a word, maybe it isn't, but anyway, does prevention of canine overweightness and obesity reduce osteoarthritis prevalence? So can you actually stop it occurring? Or does weight loss actually improve clinical signs if they've already got an overweight dog with osteoarthritis? So 2 questions that they wanted to see if the literature could answer. Okay, so they looked at all the studies that were done both in people and in dogs. And there's class 1 human studies that definitely show a link in humans between obesity and overweight. We've seen some of those. So it's definitely true in humans that there's a link, but the mechanism is maybe a little more confusing. So biomechanical link obviously makes sense. You know, if you're overweight, you've put more weight on your joints. But it isn't just that. There's actually a biochemical link. So let's look at this. So biomechanics makes sense. You have increased load on the joint. But it's not even just the increased load. You're actually potentially changing how you weight bear on your joints, depending on how heavy you are. So you might change your posture and the kinematics in your joints, so you're actually not weight-bearing the same cartilage. So you're actually starting to stress cartilage that's not used to having that amount of stress on it. So you actually, with malalignment, change what's happening and damage to the joint. Okay, but there's a biochemical factor here as well, which I found fascinating. I hadn't really ever thought of it before. So we kind of think fat is fat, right? It's not really that significant, but actually it has a whole lot of metabolic stuff going on that we probably never think about. So as somebody said, it's an organ in its own right. So those fat cells, those adipocytes, produce adipokines like leptin and adiponectin, which actually have been proven to have detrimental effects on cartilage. So the fat is actually not just making you heavy and loading the joint, but it's actually producing something that's probably damaging your joints as well, cartilage. I think that that's kind of interesting to think about. There's a study showing that the leptin levels in dogs that are overweight go up, and they have more arthritis. So there seems to be a link in dogs as well. So interesting. There's also a link shown in at least people with cardiovascular disease, suggesting that that's also affecting blood flow to the joints and damage to the joint, and there's a link between osteoarthritis and cardiovascular disease. Likewise with diabetes. So there's all these kind of factors that I guess we never really thought about that links the two together. And obesity is linked to all of those together too. So what about in dogs? Well, we don't have class 1 studies, so you remember this evidence-based stuff. We don't have the class 1 studies that really show us this, but there are class 3 and 4 studies. Mainly, one of the major studies that looked at this was the one that you probably all remember, where they paired 48 Labrador retrievers. They paired them together from birth, and it went for 14 years or something, and they ad-lib fed one of them, and then the partnered one that was matched was fed 75% of that, and you probably remember that study, or may remember that study. And it was basically showing that the dietary restricted dogs that had better weight lived 1.8 years more longer than their paired partner. So what about that study and looking at osteoarthritis? So they found that there was a significant reduction in clinical hip dysplasia. So these are dogs, these Labrador retrievers were actually genetically chosen to develop hip dysplasia. They were genetically predisposed to developing hip dysplasia. So this was a significant thing to reduce the presence of osteoarthritis in these dogs. So they could prevent it from being clinical by being careful with the diet. So think about that with all your overweight, fat puppies that are likely to develop hip dysplasia. If you can limit their diet as they grow, you have a chance of reducing the clinical problem with osteoarthritis and radiographic changes with osteoarthritis. So even if they developed hip dysplasia, they had less osteoarthritis development. And that was true in the elbows as well and shoulders. They might still develop the problem, but they'd had less demonstration of osteoarthritic changes. So there's definitely a link there. It's just that was counted as a class 4 study because it was not pet-owned dogs. Okay, so we need more studies to kind of look into this, but there's definitely something happening there that looks like it's probably going to follow what we know in people. So, does prevention of canine overweightness and obesity reduce osteoarthritis prevalence? Yes, I think we've got enough evidence to say that. And will weight loss alleviate clinical signs of pain and disability if they're overweight? Yes, I think so. So that's a good thing to know.